This is Kerri Wachter reporting for Global Medical News from the American Academy of Dermatology's annual Summer Academy in Boston. Joining me is Dr. Joel Gelfand, who is an assistant professor of dermatology at the University of Pennsylvania. Dr. Gelfand gave a talk evaluating the risks of lymphoma in patients on biologics.
Would you discuss the idea of the association between lymphoma and the biologics, and that the cause isn't exactly clear?
Well, I think really the big question that dermatologists are wondering about is, do these biologic therapies, which are immunosuppressive, cause lymphomas? And if they do cause lymphomas, what is the actual risk to patients? How much do we need to be worried about this? And the best we can summarize from the data that we know about is that in a handful of isolated cases, there have been case reports of patients developing lymphomas on these drugs, which then resolve when the drugs are discontinued. And so many people felt that sort of establishes a possible causal relationship in those individuals. However, in other larger studies, observational studies of thousands of patients, particularly those which are controlled for the underlying severity of the disease being treated, such as this case, rheumatoid arthritis, the studies have resoundingly found that there's been no increased risk of lymphoma associated with TNF inhibitors, for example. And these are studies that typically have followed several thousand patients for on average 2 to 3 years or 4 years on these drugs. So the best we could say is that in some isolated circumstances, it seems that patients can develop lymphomas or lymphoproliferative disease in the setting of TNF inhibitor therapy. In these cases, we certainly should stop the immunosuppressive therapy to see if the disease will improve. But overall, the absolute risk to the patient appears to be quite small. In a recent review article that came out, it suggested that you had to treat at least 2,000 patients to see one additional lymphoma that may be related to the therapy or possibly related to the underlying risk given by the disease.
But it is still something that you need to discuss with your patients, even though the risk seems to be fairly...
Yes, even though the disease, the absolute risk is quite small to the patient, by treating many patients in many practices all over the country, certainly there will be patients affected by lymphoma during the course of their treatment. And I think it's very important that patients fully know all the risks and benefits of the treatments that they're being given, especially for a chronic therapy. In this case, we may be committing patients to courses of therapy that go on for many years, and we want to make certain that patient fully understands all the concerns, even if some of those concerns are mainly theoretical in nature.
So, and right now we don't have very long-term data on patients on biologics, so do you think it may be that in years to come we may see some trend that we don't pick up in the early disease?
It's hard to say. That's really exactly the reason why the studies need to be done. As a class of agents, TNF inhibitors actually are probably some of the best studied drugs we have. Some of their benefits is that, one, they are commercially successful. They've been used in lots of patients, across lots of indications, allowing for the opportunity to study patients. And two is they really have evolved predominantly in the post-Vioxx era, which has really led to more stricter understandings by regulatory agencies of the importance of post-marketing studies to truly better understand the long-term risks associated with any therapy.
This is Kerri Wachter reporting for Global Medical News.